Welcome back. Thanks for staying with SABC News. World Oral Health Day aims to empower people with the knowledge, tools and confidence to secure good oral health. But it's not only about regular dental checkups, brushing your teeth twice a day and eating a well-balanced diet. Oral health is also affected by a cleft lip and cleft palate. These are openings or splits in the upper lip or the roof of the mouth and are caused when facial structures that develop in an unborn baby don't close completely. To help us understand more about cleft lips and the significance of oral hygiene, we are joined by oral hygienist Saras Naidu. A very good afternoon to you, ma'am. Thanks so very much for joining us here on SABC News this afternoon.
Thank you. Thanks for having me.
As a start, Saras, let's start by understanding what exactly cleft lip and cleft palate is. And am I correct in assuming, and perhaps it's a silly question, that there's nothing that can really be done to try and prevent this? I mean, one just sort of waits for the baby to be born and then deal with the problem afterwards, correct?
Well, it's due to many factors. It could be genetic. There's still a lot of research going on. But, the treatment starts from the time the baby is born.
Yeah, and you told me as we were chatting off air about the work that you're doing with the Woundworth Foundation, because what I did want to talk about was for families who are able to afford it, I suppose it's a relatively easy thing to go to the doctor and get it sorted out, but there are very many underprivileged people in our society, no doubt. Talk to us about the volunteer work that you're doing with Woundworth Foundation. I understand it's a non-profit organization.
Yes, so this foundation has been started by Dr. Singh, an orthodontist, and it treats the poorest of the poor in KwaZulu-Natal. It's the only non-profit organization in KZN that gives free treatment to the poor. And our biggest sponsor is Smile Train, which enabled us to see more patients and to help more people.
And what are some of the oral health challenges facing children that are born with a cleft lip?
Well, these children are actually more prone to caries and gum disease and eventually tooth loss, which actually complicates the treatment.
Let's talk about oral hygiene. How does one start in terms of improving one's oral health? In the adult years, I suppose one gets a little bit more lazier. When you're younger, your teeth start to fall out and, your mom will ship you off to the dentist and so forth. But, how do we start to sort of improve our oral health, particularly in the older years? Because that's actually when it's most important, I would assume.
Yes. The thing is, it should start from a baby. So from the time the first tooth appears in the mouth, the mom should start brushing and teaching the child, how to use a toothbrush and toothpaste. And it's so important for parents to take their children to the dentist or the oral hygienist every 6 months, to just check and to do the preventative aspect like sealants and fluoride varnishes, and to teach them the proper techniques of brushing and flossing. Obviously twice a day, brushing, flossing every night is very important. By the time you get to your old age, it's already too late if you haven't developed good oral hygiene habits.
Yeah, and just now I spoke from a position of privilege where I spoke about the fact that your parents will just take you to the dentist, and we take oral hygiene for granted, many of us, because it's very easy to be able to just go to the dentist and seek help. But for many it's not that simple, and I know you're doing a volunteer work already. There are some expensive procedures, and as we observe Oral Health Day, I wonder how much attention is given to that issue, that it's not always so easy for those vulnerable in our society to be able to access oral hygienists like yourself.
So, there's a lot of work that needs to be done in the public sector. because most patients cannot access this, this service.
Yeah.
And also in KwaZulu-Natal, I mean, in the country, the majority are very poor, and they are more concerned about their basic needs like food and shelter and water, which in a lot of cases they don't have.
Yeah.
So oral health is last on their list. So what we can do is provide a service whereby these people are educated, and like Colgate is a major sponsor to the Woundworth Foundation with toothbrushes and toothpaste. They're just showing them videos and making literature available in their language, just to make them aware of these things. And as we know that now research has been done that links poor oral health to systemic diseases like hypertension, diabetes, even osteoporosis.
Yeah, and just in closing, I mean, how can healthcare systems work together with orthodontists and people like you to enhance access to quality treatment? And I suppose it is also, the onus is really also on the government itself. Yes, there are government facilities that of course you can get healthcare for free, but there, again, you go to these villages, for instance, where it's very difficult to even access those that are free. And I just wonder how everyone can work together to make sure that access to quality treatment is easy to get.
Yes, well, people don't really understand the importance of oral health and how it affects the body. So I think even in the healthcare sector, the medical professionals and all types of professionals need to actually be aware of how the mouth affects the body. And once this is done, you can actually just educating them, just giving them, letting them watch videos, and just more oral hygienists and dental personnel, maybe mobile units, going to the townships, going to the rural areas, and just educating them on it.
All right. Sarah, it's a great pleasure speaking to you. Thank you very much for giving us your time here on SABC News. And thanks very much for the volunteer work that you are doing for those disadvantaged in the country. We appreciate it.
Thank you.
Thank you so much.